Hello everyone. Today I'll be addressing another of the frequently asked questions at our clinic. So again, when we advise TMS to patients, many people ask us this question: what are the side effects of this procedure? So in this video, I plan to discuss briefly the common side effects, the rare side effects, and some other safety related aspects of TMS. Coming to the common side effects, the most common side effect of TMS is headache. So first we'll look at why it occurs. So in TMS, we place a coil on the head, either in the form of a figure of 8 kind of a coil or in the form of a helmet. Both are placed on top of the head and the stimulation is delivered through the scalp. So increased scalp muscle tension is said to cause the side effect of headache. Now, is it serious? No. In most patients, it's what we call self-limiting, that it goes away by itself, and our experience in the clinic is that most of the time we do not require an analgesic. If we do require an over-the-counter analgesic, can be used to reduce this headache. Now, how common is headache as a side effect? Research estimates say it occurs in between 7 to 15% of patients taking TMS, and in our own clinic's data, the estimate is at around 8%. Also, in our experience, the headache is mostly self-limiting in that it goes away by itself, and we also see it more during the initiation of treatment, that is in the initial 4 or 5 sessions, and subsequently it goes down by itself in our observation. The next common side effect that I want to tell you about is pain at the stimulation site. So this one requires some understanding of the equipment used for TMS. In some of our previous videos, you must have seen the different types of TMS coils that we use to give transcranial magnetic stimulation. So there are figure of 8 coils or double cone coils, which are slightly older TMS coils, and there are newer versions called H coils, which come in the form of a helmet. So in this, the pain at the site of stimulation, or where the TMS coil is placed on the scalp and delivering magnetic pulses, that is more common with the older designs of figure of 8 coils and double cone coils. Another question regarding side effects that we commonly get is there a risk of any serious side effects? So the answer to this is yes, there is a risk of one serious side effect, which is mainly a seizure or a fit, but the risk of this is extremely rare. To put this in perspective in terms of numbers, there was a 2021 study published which evaluated around 5,85,000 TMS sessions in over 25,000 patients. Here, the risk of seizures was found to be 0.003%, which translates to around 3 seizures in 1 lakh sessions. To add our own clinic's experience to this, in the 1,000 plus patients and 20,000 plus sessions that we have performed at ANC, we have not had a single incidence of a seizure so far. To give you a little bit more information about this, there are international consensus guidelines about what safety protocols are to be followed while giving TMS. The answer to that is yes, it is a safe treatment in people without any risk factors, and when the safety protocols are followed, the seizure risk is near to 0%. Most of the adverse effects are minor and self-limiting, and when we compare dropout rates as an indicator of treatment safety, TMS has one of the highest treatment completion rates when compared to other modalities of treatment for psychiatric disorders. In our own experience, the treatment completion rates approach up to about 75%, which is a very good treatment completion rate in mental health conditions. I hope you found this video informative. If you have any more questions about the safety aspects of TMS, please feel free to drop them in the comments. Thank you.